Greetings, everyone. Good morning, good afternoon, good evening, depending upon where you are today. Today's webinar is focusing on agility in healthcare services. And I'm using some of the insights that I have had based upon my experiences in the clinical and surgical settings. My name is Dr. Sriram Rajagopalan. I'm consulting as an enterprise agile evangelist at Inflectra Corporation. I have my Ph.D. in organizational leadership and management, MBA in management, Master of Science in computer engineering, and a bachelorate in electronics and communication. I started my career as a software engineer, continued the career ladder as team leader, business analyst, project manager, scrum master, agile coach, and I have served in the capacity of director and vice president managing program management office. I have a number of different trainings and certifications: personal agility recognized practitioner, personal agility recognized ambassador, scrum ambassador, licensed trainer, portfolio management, program management, project management, scrum, risk management, agile, Six Sigma black belt, and a number of different things. I'm also an instructional designer, speaker, writer, and author. I have facilitation experience in several institutions in the United States, India, United Kingdom, Canada, Switzerland, Brazil, and Vietnam. My book is called Organized Common Sense, where I talk about why project management and agile skills apply to everyone, regardless of your choice of profession and even age groups. It's available wherever books are sold. Today's webinar takes an exclusive focus on the importance of adopting agile mindset by showing how it is already used in the healthcare settings. Our webinar is part of the Thought Leadership series. Sometimes the webinars use a tool to demonstrate the concept. In this webinar, I'm not using any specific tool. I'm approaching agility in healthcare from three different angles. First, I want to talk about what is the healthcare mindset. And then I will focus on applying agility on the healthcare domain. And then I will focus on how to lead change. Now, every time I talk about agile in the healthcare, people come and say, wait, what? Are you out of your mind? In healthcare, we deal with life. We don't have the opportunity to issue a patch just like how you do it in software. So we can't apply agile approaches used in software development in the healthcare field. So I started asking the follow-up question. Well, if you know about Agile Manifesto, what does it say? Immediately, people come providing those four important principles, like individuals and interactions over processes and tools, working software over comprehensive documentation, customer collaboration over contract negotiation, responding to change over following a plan. Now, these are very important tenets of Agile Manifesto. No questions about that. And if you pay close attention to that, it basically says everything in green that is on the left-hand side is more important than the things that are on the right-hand side. So individuals and interactions are more important and valued more than the processes and tools. Similarly, responding to change over following a plan. Now, Agile Manifesto did not start with this four important principles. It basically started telling we are uncovering better ways of developing software by doing it and helping others do it. Now, remember, Agile Manifesto came into existence by 17 people who were all in the field of computer science, information technology. They were developers, architects, and engineers and testers. And so that's how they framed this. Now, I took a look at this statement and said, what if, hypothetically, we replace the word software with healthcare? Let's read this. We are uncovering better ways of developing healthcare by doing it and helping others do it. Seems fine to me. So, Agile Manifesto can be slightly modified and still be applicable in a healthcare field. But then I started looking into what does healthcare mean? In fact, when we say caring for health, what do we mean? Now, health means, according to World Health Organization, the complete state of well-being connected to physical, mental, and social. So all the three elements have to be present, physical, mental, and social, in order for us to say, we are catering for the full holistic healthcare. Now, when I took a look at this definition of what healthcare actually meant, I felt I saw agility applied everywhere in the healthcare domain. For instance, in physical therapy, I saw specific ways of how agility was applied. Similar thing with clinical decisions, and even in a surgical setting. And fortunately, I had experience in all these three domains to see how it can be applied as well as how it was already getting applied. So let's take a look at some of these things again. Now, before that, there are 12 agile principles that agility promotes. And these are this: satisfy the customer, welcome change, iterative delivery, daily business collaboration with business and technical people, working software, sustainable pace, work around motivated team and trust them, face-to-face collaboration to pick up things that are not necessarily said, technical excellence in what we are trying to do, keeping it simple, ensure that the team is self-organized, and we reflect and adjust. These are the 12 important principles of Agile. Now, if I superimpose healthcare related domain here, it was still applicable for me when I said, instead of satisfy customer, let's satisfy the patient. Instead of daily business collaboration, frequent healthcare collaboration. Instead of working software, is a working assessment. Instead of technical excellence, it's medical excellence. All the other things still apply. Symptoms change, the way we deliver healthcare changes. We want to have a sustainable pace. We want to work with motivated teams. We have to have some face-to-face collaboration with the doctor and the patients, and keeping it simple, self-organized, reflect and adjust. All these things still apply. So I made sure that I'm going in the right track, and I said, like, okay, I have verified the 4 tenets, I have verified these 12 principles, let's move forward here. So my question was, can healthcare even sustain itself without agility? The sub-question then I started asking was, will there be quality healthcare in the absence of any of these 12 agile principles that optimize for risk and cost? Let's see what I found out. Now, about September 2019 or so, I was involved in a car accident, and I had some shoulder related problems as a result of that vehicle accident. Now I went and saw the physical therapist and continued to get treatment. And the way it worked was, when I approached the actual physical therapist, the goal was to relieve my pain and get my mobility back. And the way we approached the treatment plan was in a progressive planning approach. First, they did an assessment, finding out where I was and comparing it with my other shoulder and where I felt there was immobility, pain. They did an assessment, and they also did some diagnostic images to find out if there is any structural problem and things like that. And then they continued to move forward with a treatment plan, which was like iterations 2 to 5, that focused on giving me some electrical stimulation followed by some physical therapy. And then the doctor assessment was in place. I had to go and see the doctor and see whether I was doing better or his treatment was working as expected. And then, there were 5 more weeks of additional exercises that followed with more focused physiotherapy and exercises. But the electrical stimulation was dropped. Subsequently, I went for another assessment with the doctor, and the doctor came back and said, "Met better, but could be better," and so start working on repeating those same things for a little bit more. So 11 to 14, the weeks, I continued to do the same thing with the physiotherapist with more exercises, focused exercises, in fact. And then the doctor assessment was done. And then the idea was to repeat it for a couple more weeks and transition to home exercise plan, right? And when we went for this day one for my treatment, there was no big planning of let's talk about how many weeks we have to take, and we are going to take 20 weeks. We are going to figure out how you are. No, that's not the way it worked. We had specific iterations or release plans, like we're going to do 1 month and we are going to see you twice a week for 3-4 weeks, and we will do an assessment at that point, and then depending upon that assessment we are responding to the change. And to me it sounded like we are following Agile. We had a specific release plan, the minimum viable product, and once that was done, we moved forward, did an assessment, and then moved forward with the next release with specific iterations in between. So we continue to move forward in a progressive way, right? Phased approach. To me, that is Agile, but there was no awareness. When I talked about these things, you are doing these kind of principles and things like that, there was no awareness. Let's talk about a surgical setting. My mother, several years back, had cardiac problem, somewhere closer to heart attack, but she did not have an heart attack. And so when these symptoms were discussed and evaluated, open heart surgery was not immediately planned. As soon as the potential for a heart attack was present, immediately the doctors did not come back and say, well, let's do a open heart surgery and get your mother treated. That was not the case. What did we see? We see the lean principle applied here. Lean principle is avoiding anything to the last minute until absolutely necessary. When you are doing an invasive procedure, the opportunities of risk is very high. Could get into many complications, infections could come, and many things that you don't necessarily need to have could actually come. In other words, when you respond to a risk, you are creating secondary risks. And when the baseline was properly established, when my mother did have a heart attack, the decision was swift. From the diagnosis to being in the operating theater was quickly done. Now ask yourself, if this medical profile was unknown, could decision making be done so quickly by the doctors to save life? So without a baseline, you cannot continue to move forward correctly at all, because there needs to be some additional checks and balances that need to be verified, and the time to operate now is getting delayed because of those things that you don't have much in advance. So those things truly were an example of how lean and agile principles were truly applied, right? So prioritization was there. So post-surgical follow-ups, after the surgery also, there were some specific procedures that were in place before she could be discharged. Like proper health regimen has to be followed, including the diet and exercise, and most importantly, her happy state of mind to be discharged. So I went and talked about these things to the doctor who was treating my mother, and he came back and said, well, you must do a presentation on how we can become aware of, as well as apply these principles to improving the healthcare outcomes for our patients. So in simple words, I feel agility breathes life into healthcare. And this is applicable in every scenario that I have experimented in life. And I'm sure you can relate to all these things as well. Like some of the OB-GYN decisions that go through for the trimesters. what needs to happen in the first 3 months, second 3 months, or third 3 months. There are some predefined things that exist on what needs to happen, and if those things don't exist or follow through correctly, then you are putting in appropriate checks and balances to make sure that things are fine. And same approaches in the well baby care. From the time the baby is seen to the time the actual person becomes a teen, there is an expectation of what should be the growth and development in every phase. Regular wellness checks. As we are trying to go through some of those regular health checkups with annuals and physicals and things like that, there are other things that come into play. Like if you are 40 years and above and a female, you have to go for a mammogram. If you are 50 and above and a man, you have to go for prostate checks. There are things like that are coming in. And there are some special scenarios based upon health history or your own progression of health. There could be conditions like diabetes or arthritis that will require some additional blood work and lab works and things like that that will be managed. Right? So whether it is going to be a very healthy, great life, or it's going to be somewhat symptomatic challenges in health routines life, it doesn't matter. It breeds agility in every phase. And what does that mean when I say agility breeds life into healthcare? Because you are persona specific. In other words, we are making it specific to the person. We don't come back and say everybody has to progress along the same curve, because Asians will progress differently from members of other countries. And every time we do, we are optimizing for risk. We want to take into consideration your specific, patient-specific considerations, like body mass index, for instance. You don't give any dosage amount. You give smaller dosage in milligrams or micrograms, depending upon what that particular medicine is, and then try to increase the dosage according to patient-specific considerations, demographics. What are we doing? We are building quality into our regimen. And as things progress nicely or do not progress as expected, we inspect and adapt. And we put some specific time box in terms of how soon we will inspect and how much adaptation we will do, and the specific cadence. So these things are applicable in every part of our healthcare checks and balances. So let's take a look at some little bit more about patient-centered interviewing. So in a non-urgent scenario, when I mean non-urgent scenario, you're not going into urgent care or emergency, just regular annual physical or health checks or things like that. When those things happen, what's the goal that we start with? The doctor engages in eliciting more from the patient in terms of why the patient is here to see the doctor, like the patient's perspective, psychological context. So whenever somebody comes and says, I have a headache, immediately the doctor doesn't give a specific medicine. There is a lot of additional things being discussed here to look into the treatment options that are going to be shared. It's not going to be what I say you have to do. There's going to be a handshake agreed upon between the physician and the patient, right? But what is that interaction focusing on? Building rapport with everyone at the visit. Sometimes the patient may not be able to articulate exactly what that patient feels. So we are talking to people that are along with the patient, like the mom or the dad or the sibling or whoever is the custodian is bringing there. Sometimes the patient could be an animal, like a veterinarian is going to look at a dog or a cat, and the dog cannot articulate. So we have to engage in different forms of listening. And we are trying to negotiate and prioritize value. So when the patient comes and says, I have 3, 4, 5 things, the physician engages in a dialogue to say, among these 3 to 4 things that you are discussing, tell me which one is the most important thing that needs to be addressed. Right? And this is still in a non-urgent scenario, so there could be dialogue. And explore further on the symptoms, like how long has this been happening? If you say, let's say you are having a ringing in your ears, when did this happen? How long does the ringing continue? Have you seen any patterns that it happens in the morning or in the afternoon or while in the car or while at home or watching TV or whatever it is? We are asking for more information, right? So we are gathering more information that the patient immediately may not find relevant to say, but that will be relevant for us to further proceed with the alternative treatment plans. And we empathize with the patient. So the patient says, like, this is the most important pain, this is, I cannot bear it, and exacerbating pain and things like that. But we want to take that subjective pain into some kind of a scale, and that's why people come back and ask, like, on a scale of 1 to 10, 1 low, 10 high, where would you place yourself? Right? Diagnose, laying out alternative plans. So we don't immediately come back with, okay, we're going to do this. Instead, we say, okay, let's try to drink more water to take care of your headache, or maybe I'll give you this particular medicine over the counter. You can take this, or if you definitely want a prescription, I can give you this. And if this continues further, we will look into maybe doing some x-rays to find out if there is something going on. So we are trying to come up with alternative game plan, but discuss it along with the patient to get a consensus, right? And then we put the plan in action. We basically have some pre-follow-up procedures, maybe another blood work to check for sugar or blood pressure or many other things that we may want to check. The physicians will know better on these things. And we put together a follow-up criteria. 3 weeks from now, you will do this. You will practice these things and you will take these medicines in this particular prescribed fashion and then do this lab work and then come and see me after so-and-so time. Right? We agreed all these things. And what are we focusing here on? We are starting with a why. And if you remember, in the project management and agile and product management, those kind of disciplines, we talk about the 5W and 1H. I discussed this in my book as well, The Organized Common Sense. The why, what, who, where, when, and how. Right? Those are the 6 friends that I call. So we are talking about why here, and these principles are focusing on the what, and the next one is focusing on the how, and these things are focusing on who will be responsible, and these things are talking about where this will be done, and these things are talking about when it will be done. So principles of how we do this is applicable here, and this is the reason why I say these are all organized common sense, right? Now, if that's not enough, we do have a plan, do, check, act that we say as way of progressive planning. We don't do a linear waterfall approach where we have to do everything together. Instead, we come back and say we'll focus on these things, we'll plan for them, we will do them, we will check the progress, and then we will act accordingly, right, for subsequent phases. And this is the plan, do, check, act. This is still applicable even in every non-urgent scenario. People will have still come back and say, well, Sriram, this may be true, but in emergency room facilities, this is not necessarily true too. Well, I applied them in an emergency setting too. So even in an emergency facilities, I found agility applied over there. Several weeks back, or actually several months back, I watched a TED Talk by Dr. Daria Long. And she works in the emergency facilities. And she came and said, if we allow ourselves to be crazy, we make ourselves less capable of handling busy scenarios because we allow the stress hormones to impair our decision making. And that's why she says in an emergency setting, she never calls having a crazy day. How do we sometimes react? Oh, I'm having a crazy day, I have a crazy week, I have a crazy meeting, I have a crazy this, I have a crazy that. Which means we are allowing our stress hormones to increase and impair our decision making. And she comes and says, well, I'm going to use my ability to be calm to come up with these elements. Know your red, which means know is absolutely important, that needs to be done. There is no negotiable here. This has to be focused on. Know your red. And in a healthcare setting, sometimes we have to differentiate the signal from noise. And in engineering terms, we talk about the signal to noise ratio. So just because somebody keeps on talking doesn't mean that that particular information is extremely important to be acted upon in a healthcare setting. An asthmatic patient, if that person doesn't say anything, that's a big indication of a problem too, right? So know your red, either by observation or listening, and many techniques, right? And then the other end is going to be know your black, like where we have to go back to the patient or the patient custodian and say, this is where we will not be able to continue anymore any further, because we are giving everything that we have done, we can possibly do at this particular point in time within the resources that we have available. So know your black, right? In between these two bookends or extremes, she basically says we have to follow a protocol, which is going to be plan incrementally. And this is coming from an emergency room doctor, physician. Automate repeat work, which means don't try to do things that can be done by a machine. Co-locate to save time. Make sure that all the important medical supplies are all available in the same place instead of running around and looking for them and wasting time, because you will not have time to look for them in an emergency setting. And decrease distraction. Make sure that things are that could take your time away are not there. Maybe even a TV or some other things. So whatever it is, this is how she says we manage the work queue of people that are coming in and how to service them. Look at the words here: plan, automate, co-locate, decrease distractions. These things are all choice of words that we use in a software environment too, right? So even emergency room facilities apply these concepts. Now, at a minimum, these things show how we continuously prioritize and how we improve continuously. And this goes back to some of the principles like Moscow, the must to do, should to do, could to do, and want to do, right? That are applicable in the product management terms. Now, adapting agile principles. I want to talk about a surgical case study that happened in June to November of last year, 2020. And I want to introduce Li Hua from South China. He is considered the folded man who spent almost 28 years of his life in this bent position. And this happened in the later part of 2020. Okay. And let's look at how he was getting treated and what the condition was. He was diagnosed with a condition called ankylosing spondylitis at a very young age. It's a condition that fuses the bones, making the spine curve forward. As time progressed, his entire upper body folded forward onto his limbs. That's why he ended up as a folded man. Almost to the extent that his chin was touching his chest and his breastbone was folded to the pubic bone, and his face as a result was fused with the thigh. He was treated by Dr. Cho Huron at Shenzhen Hospital. Okay. Let's talk about how this particular doctor approached the treatment plan. The doctor took almost 2 weeks to come up with the plan itself of how he's going to be treated. So, in product management terms, software product management terms, this is a roadmap. And he came up with the roadmap that had 4 different operations. And the first operation was a femoral osteotomy. Osteotomy basically means breaking up bones. Because his bones were all fused, the bones had to be broken up and reconstructed. So the first operation was a femoral osteotomy. That is requiring to have space between his face and thigh so that the doctor can do the subsequent operations. This was a prerequisite. And remember, I said He was a folded man. So normally, if you want to give anesthesia, you would put a pipe and then send anesthesia very easily. The anesthesiologist could not do that. And an anesthesiologist required the support from the actual patient himself to access his mouth to administer the anesthesia, according to Dr. Sun Yun Won. The second operation was a cervical osteotomy, which was breaking up and reconstructing his cervical spine. And this operation took 6 hours, and the previous operation took 3 hours. And then the third operation was a lumbar spine osteotomy, where he has to actually start working on how to break up his lumbar spine. And finally, the fourth operation was replacing his hip joints so that he could actually stand up. So the operations took a lot of hours, like 3, 6, 10, and 7 hours for each one of those operations. This is how he actually planned. So there was a roadmap and a release plan with specific iterations. Each operation was an iteration, and how he continued to move forward into the whole process. Now, from the eyes of agility, the goal was to let the patient stand up, in my view. So progressive planning maintained that goal. So we did not come up with an idea of how we will do all of them at the same time. In other words, all the 4 operations were not done at the same time. Instead, they were all spaced out. Progressive planning maintained that goal as a milestone from each and every operation to continuously do, plan, do, check, act. Each surgery itself was an iteration with a specific goal to accomplish the space that is required between face and thigh, to introduce extra space required for cervical bones and then the lumbar bones. And so there was a specific goal for each and every one of those particular iteration or operation. And for every one of those surgical operation, there was also some specific thing that needs to be done, that he is available in terms of his health, there's no fever, or many other things that could complicate continuing to move forward in the plan. The team included the patient, the patient's mom, and several other people who has to be available. The infectious diseases, the orthopedist, and the chief surgeon. So even though there were many other people, this chief surgeon was acting as the main person. And we do that in agile approaches too. Even when there are going to be multiple teams working on, there is going to be a single product owner. Each surgery had to review the success criteria and that he did not have any further complications developed, because as you are doing so many surgeries one by one, the immunity system takes a toll. And there were reviews and retrospective that factored appropriate interdependencies and the additional risks for subsequent surgeries that needed to be in place. So from the eyes of agility, this was a perfect case study for me to say this surgery followed agile principles. Kudos to Dr. To, Lee, and Lee's mom. He is finally a man who can stand up. And this happened in the later part of 2020 when we were all talking about the pandemic. Imagine the complications of the pandemic on top of the procedure that was done. Lee finally came back and said, I could finally take a closer look at my mom. Great medical miracle, in fact. And when you take a look at these principles that are already being applied, why are certain challenges still being thought through in the agile healthcare field? And there are 3 important myths, in my opinion, that are coming up repeatedly. The first one is agile does not have enough rigor to ensure safety and reliability that healthcare demands. The second thing is processes are not valued. Certain processes that we have to do are not valued, making agile a non-compliant process to adapt in a healthcare setting. And the third thing is the healthcare processes or predominantly waterfall due to the planning needs, and we cannot adopt agile as a result. These are the things that keep coming up, and I want to address them head on. Okay. So let's take a look at the first one, which is going to be no rigor. And my question is, which of the 12 principles say safety and reliability are optional? If I go back and look at those 12 principles, I can find anything that says don't worry about quality, don't worry about safety, don't worry about reliability, just do because we are following Agile. We don't need to worry about the body mass index of this person and just give whatever dosage we want to give. I don't think any of the principles say, if practice followed something incorrectly, like substance abuse problems comes, that's a different story. But none of the principles per se say this, right? So to me, that's just a myth that we are creating. The second one is medical processes will become non-compliant because we are saying certain processes need not be done. And this is going back to those 4 valued pair, where we are saying like individuals' interactions over processes and tools, those 4 pairs. Now, the focus here is these things are more important than something else. That does not mean don't do that. If comprehensive documentation is required as part of you releasing your product, then make it part of your requirement. So what part of valued more versus valued less said that the later should be avoided? Now let's take a look at the third one. The third one is healthcare processes or waterfall. I don't remember which specific FDA or Food and Drug Administration document specifically said you have to follow waterfall for us to say you are following all the processes required to be compliant. I don't recall any specific document that says that. And granted, I'm not going to be an expert on all the FDA's documents here. But to my knowledge, I don't think there is anything that specifically says this has to be done only the waterfall way. The processes do not come and prescribe a specific framework or development methodology to say this is what you should do. So let's move forward over here. So I want to make sure that these 3 things that people are talking, we are creating a monster that doesn't exist, and then we are feeding our fears to the monster and say, well, we can do, agile in healthcare. So the agile boat is cruising already. Hospital needs, when you look at them, they are talking about transparent and transient inter-organizational links. Different things within the organization of the hospital chain should work together. You've already been talking about this for a long period of time, in fact. A market sensitivity and customer focus, that is again repeatedly coming up. Because the hospitals have a mandate to make sure that the readmission rate is not too high. Once the patient is discharged, if the patient gets readmitted for similar symptoms or infections coming out of the previous admission, then that's a problem too. So there are a lot of different focuses on how we are addressing those challenges. And management of self-organized team. How can a floor, cardiac telemetry floor can be self-sustaining? How can the pharmacist in the floor can be self-sustaining? In things of that nature is constantly coming up. Elastic and responsive organizational structures. As the patient demand suddenly goes up, how do we accommodate more patients? And there is a substance abuse problem coming up. How do we handle that challenge, very quickly? These kind of challenges are already present. If there is a lack of blood supply for a specific surgery that needs to happen, what do we do? And so these things are already present. Flexible human resource capacity expansion and timely delivery. Contract nurses, for instance, to come and help. Contract volunteers to come and actually help. So these things are already being present and discussed in a hospital setting, the healthcare organizational setting already, right? So a food for thought here is, if environmental uncertainty needs to be matched with other coping strategies and organizational capacities for design processes, then healthcare also will benefit from these principles. Lean and agile can still be combined to give the better optimization that the hospital needs to meet the variations in demand and still provide good patient care management, because ultimately satisfied patient is the most important healthcare goal. Right now, these are all practiced already in different studies in hospitals. There was a couple of hospitals in Sweden that attempted to implement patient-centered approach in different ways. Hospital A in the study actually adopted a top-down management where they come and put strategic processes, resource alignment, and trainings and interdepartmental efficiency, and everything that went with that top-down way of how a hospital should be run. And hospital B empowered in the management, the line management, to manage its own internal and external resources. And along with that came the financial considerations for training and budgeting and resourcing and many other things, raw materials and many things. The study reported that Hospital A was statistically effective. That means it was effective, but it depended upon the management to make any decision when there is a sudden increase in demand. They expected the management to intervene and provide the solution rather than they providing the solutions themselves. And that's what the Hospital B was found to have. They were dynamically effective. They readjusted themselves according to the demand. So these studies demonstrate that agility is still applicable at a larger healthcare facility levels, right? And continuous recommendations were coming up from these studies that said, continuously adapt and improve alignment for the internal and external conditions by adopting agile and lean principles for effective management. Now, studies continue to exist. There are several experiments that different people are doing. Global health specialists, consisting of nurses and physicians, applied agile experiments in developing solutions for hospital-acquired infections, such as things that could be avoided by hand hygiene. Physicians adopting agile experiments reported that there was a reduction in the opioid prescription, the painkiller prescriptions after C-sections, by following experiments in which the patients were educated and the physicians were educated, and there was a lot of collaborative work in reducing the actual opioid. And in another instance, a group of healthcare specialists collaborated with technology-based interventions for diabetes management. For instance, letting you know that it is time, sending you a text message or a voice message, then that you are ready for your blood check, or your sugar may be going low here, eat this or experiment, time for exercise, and repeatedly reinforcing using technology enabled vehicles to reach the healthcare outcomes desired. So these things are all applicable in different fashions in different industries. So as a result, my thought that I'm asking all of us in the healthcare domain is, instead of resisting Agile as a software development framework, if we adopt it for its robust, adaptive, and collaborative nature, how much better could healthcare be? Now, I don't know the answer to that question, but I want to put this as the seeds for us to think through as to how we can continue to adopt agility in our healthcare setting to the extent we can to incrementally and radically innovate. So dealing with stressful changes at this point, two different people comes from two different set of domains and are giving suggestions in terms of how to deal with stressful change, because healthcare challenges are truly stressful, and they are introducing a lot of change, and it is a stressful change. There was a psychologist, Kelly McGonigal. She came and said, caring created resilience, like making sure that people come together and discuss ideas together. And this is reminding me of some of the things that I used to say. High touch is still required in a high tech world, right? And another person, not from a medical psychologist domain, but an inspirational speaker, Simon Sinek, he came and said team commitment comes from a circle of safety. When people are, feeling safe, to provide ideas that they will not be ridiculed, and things of that nature, then ideas evolve. So team commitment comes only from that circle of safety. The psychological safety has to exist. And two different groups of people came and said this, right? When you look at them, what are some of the underlying principles? On the one end, lead with strengths. Human capital is the most important thing. So lead with that strength, that listening capacity, and explore experiments. That's the idea that I'm gathering from psychologist Kelly McGonigal. Whereas on the other hand, from Simon Sinek, leading the team for sustainability. Don't just microscopically manage them, but empower them and motivate them so that they are sustainable. So that's leadership. You are transforming the team. The next is going to be team ownership. As you are trying to do this, leaders create leaders, and you are basically giving them the ownership to solve the problem, so that you create the capacity for solving other bigger problems. Right? So these are all important principles that I'm still able to observe from the experiments that I just did in the healthcare setting. So in summary, I want to bring it back to what health is. It's a state of complete physical, mental, and social well-being. And agility is a great way to solve that by bringing agility and lean principles into healthcare. And as a result of this, I have developed my own Agile Healthcare Manifesto. And so those are listed here. So listening for overall interactions over prescribing procedures in medicine. The second is complete well-being education over comprehensive understanding of medicine. The third is collaborating to sustain healthcare outcomes over insurance contract claims. The fourth is developing new solution alternatives over following a prescribed protocol. This is my view of Agile Healthcare Manifesto. Thank you very much for giving this opportunity to present to you. If you have any questions on the content, please reach out to me. Please tag your questions with the webinar title. You can reach out to support@inflectra.com. And if you have any questions regarding the course itself or administration itself, please reach out to marketing@inflectra.com. Thank you very much again for giving me this opportunity. Wish you well and stay healthy.